And I have the distinct pleasure of introducing Dr. Frank Senecal, our hero.
Great to see all of you. What a great night. What a beautiful night. My gosh. And such a great venue. So much we have to be grateful for. So thank you for coming tonight to support South Sound Care. In a few minutes, we're going to talk, or you're going to hear a little bit from a couple of our patients. Christina is going to talk for a little bit, and Julie's going to talk a little bit about their experience and how South Sound Care has provided them some opportunities that they otherwise might not have. Let me just give you some background so we can kind of put it into perspective. About a year ago, Sibel Blau and I were both partners in oncology, and we go to international meetings to try to identify treatments that may be able to help our patients in this area. This was a breast cancer meeting, and we learned about a new agent that had been developed by a small company, a pharmaceutical company. They did a small trial, about 225 patients, and this new medicine that had kind of a novel mechanism for working on breast cancer and treating breast cancer and getting it into remission was very fascinating, very interesting, and the results were very compelling. So Sibel and I talked, and we came back, and we talked to our research group, talked to our group at South Sound Care, and said, what are the chances of us acquiring that? And there was no active clinical trial going on at that minute that we could get our patients into. So we had to acquire the drug, which is a process by which we talk to the pharmaceutical company, plead our case, if you will, talk to the FDA, get those two groups communicating. And after a lot of work by our tremendous staff, we're able to bring that medication here down to the South Sound area for our patients. So you're going to hear a little about their stories here in a few minutes. Another example I want to give you just occurred on Friday morning. The evening before, I contacted our research group and I said, you know, I've been following this agent at our national hematology meetings for treating acute leukemia and myelodysplasia, two dreadful diseases. And I have a patient, we'll call her Linda, and Linda developed myelodysplasia, which is really a bone marrow failure syndrome. The bone marrow is sick, it can't produce cells, and gradually evolves typically into acute leukemia. She had done very well for 20 years because of a targeted treatment that we had found for her. However, I watched every 4 months or so that I did a bone marrow on her, and I watched the genetic characteristics of the leukemia evolve into a more and more and more aggressive character. It developed a particular mutation. The physicians in the audience will recognize it. It's TP53. It's a mutation in a particular gene that almost uniformly means that that patient is not going to survive, even with a bone marrow transplant. So we were watching this patient with her family, boating, raising their grandchildren, and the clock was ticking. So I talked on Thursday night to our research group, and really within a period of 12 hours, at 8 a.m. the next day, we had a call, an international call, conference call, to discuss access to an agent that they had developed that looks very promising in reversing that mutation and treating those patients effectively. It's the only agent out there right now. At the end of that call, their head of their science liaison head for that company said that they were so impressed with the work that South Sound Care had done in the past that they wanted to get on board and were going to do everything they could to bring that agent to Tacoma for her. That's the kind of work that South Sound Care does. And it's not me. I mean, we come up, we study, we work, we go to meetings. It's not me, it's our staff. They're so motivated and so gifted in what they do. So in addition to bringing in compassionate programs for treatment, we're very excited about some new opportunities that we have, and it's our relationships really with the community. For example, we've been able to work with MultiCare and bring to their organization a number of clinical trials focused on GU cancer. So that's cancers of the bladder and the prostate and the kidney, for example. New innovative treatments that they otherwise would not have access to. They, in turn, have facilitated our participation in what's called the Southwest Oncology Group, which is a large cooperative group sponsored by the National Cancer Institute. And we're now affiliate members of that organization, which brings a multitude of new clinical research available to our patients here in the South Sound. So thank you, MultiCare. I want to give a shout out to the GYN oncologists at CHI Franciscan, Dr. Safari and his staff, Julie Peerboom. They and we have participated together to find research options for their patients when there really weren't any good options. And finally, I want to mention an opportunity that we're working on diligently now with the Salish Cancer Center. That's the cancer center that is run by the Puyallup tribe. Dr. Stanley Liu is the oncologist there, a great guy, very well trained, experienced in clinical research. It's the perfect environment to do clinical research. And those patients need those opportunities to help them in their fight against cancer. Hopefully in the next few weeks, we'll be able to sign an agreement that will allow us to provide that to the Puyallup Nation at no cost. South Sound Care will do the work. So it's just a few more minutes, and I want to kind of review just for a moment what's happened nationally in regard to cancer care. You know, you talk to families and talk to folks, everybody's saying cancer, it's just all over the place. It seems to be getting worse and worse. Well, you're right. It's more common. There are more cancer cases than ever before. And we better be prepared because there are going to be more and more. It's just the aging of our population in the United States. But you know, because of great research, the death rate has fallen by 32% since 1991. And we just have to keep that going. We have to keep that going in our community. Why is the death rate dropping? Many reasons. Better prevention. We know how to stay healthy. Sometimes we don't do it, but we know what we're supposed to do. We're supposed to eat a healthy diet. We're supposed to limit our alcohol intake. We're supposed not to smoke. If we do those things, we can reduce the incidence of cancer about 40%. So it's our personal responsibility and it's our choice, but we have the ability to do that. We're reducing the death rate of cancer because we're detecting it earlier, better screening, and a shout out to the Milgard Cancer Center, the Breast Cancer Center. This is I'll tell you, is a world-class place. I see a lot of breast cancer patients, and I could not do my work without Milgard. They are a class organization, and they have helped so many of our women in this community. We have screening, however, also for cervical cancer, for colon cancer. Now we have screening for lung cancer, which goodness knows could save a lot of lives. The death rate is also going down because we have better technologies. Maybe the breakthrough technology that you all have heard of is immunology or immuno-oncology. You know, it's possible now, because of our understanding of the way the immune system works, to give certain medications to our patients that activate their immune system, that take the blinders off, so that our cells, our own lymphocytes, can recognize the cancer as being the enemy. A variety of different treatments have been developed over the past several years, and some of you in this audience have benefited from that. There's also great technology called CAR T-cell therapy. It's possible to take our own cells out, put them, separate them out from our other normal cells, and then manufacture them into cancer-fighting cells through genetic technology, and then give them back to the patient. This technology, in a variety of different cancers, lymphomas, leukemias, has been dramatically successful. Not in everyone, unfortunately, but in a great number of patients that otherwise wouldn't have any opportunity. What do I see for the future for South Sound, for South Sound Care Foundation, and for our community? I see us building an institute for cancer care where all of the healthcare facilities can come together and support great cancer care and great research, where we can all work together as a community. Imagine, just imagine. I want to take a minute to thank Sally, who's done so much work for our organization. And I want to thank our hardworking group of researchers who really drive this organization and come up with those opportunities for our patients. I want to thank Jody and Amir and Samantha and Jamie. And Kimberly, who is not here today, but is our molecular biologist who does so much to support our work. We're going to continue to work, and we're going to build. We're going to grow collaboration. We're going to work together, all the healthcare institutions in the community, to do our very best for you and for your families. So thank you very much. Appreciate you.